Hi, I'm here to introduce the NOW test, which is a test used for gram-negative bacteria to check your flexible scopes, the various lumens and channels. When using the NOW test, you must make sure that you're going to wear clean gloves. This is a clean procedure. The NOW test, it contains a incubator block to put your sample in, fluorometer which will read the sample, some prepackaged sterile water, the correct size syringe, some sterile pipettes, the cuvettes with the culture media in it, and sample plastic bags to collect the sample in. What you'll do is you'll open up your sterile water, take a 20 cc syringe at least. You're going to pull 5 cc's of the sterile water, so you then are able to take your sample. To collect the sample, you'll take the plastic sample collection on the distal tip, secure it like that, and now you'll be able to collect the sample. Your sample has 5 cc's of sterile water. You'll pull back and take 15 cc's of air, place it in the biopsy channel area, and slowly inject it down, and the sample will be collected in the distal tip. You can take another 5 or 10 cc's and push the air down, and then you'll go to the distal tip and take the bag off. The sample is now collected. Take it off the distal tip, close, and you're all set. The next step is preparing the sample for incubation. You're going to need a few things. You're going to need your sample, your sterile pipette, and your cuvette that has the culture medium in it. You open your sterile pipette, it's your sample. You're going to get 0.5 mLs. You'll open up the sample pack, go in, withdraw the 0.5, close it. You now have your sample, and this is your cuvette. You open it up, put in your sample, which is 0.5, close it. Your cuvette has the 0.5 ml sample from the flexible endoscope. You're now going to place it into the incubation block. You now have your sample in the cuvette with the growth medium. You'll take it and you'll put it in the heating block, and it should read 37 degrees. And now for the next 12 hours, this will sit here and incubate. What you want to make sure is that you log in what sample you have in which spot in the block. After an incubation time of 12 hours, you will turn on the fluorometer. You will get your reagent A. You will take the cuvette out of the incubator block and go to your next step. Next step is taking the top off, putting 2 drops, 1, 2 into the cuvette, closing the lid, slightly inverting it a few times to mix the reagent with the sample inside the cuvette. You now will take the cuvette and place it inside the fluorometer. There is a little line. You will take the tip and line it up like that. Take the top, put it on. Your fluorometer is on, the sample is in. This is tight so no light gets in. The fluorometer has the word measure, press measure. CH360 comes up, press that. The word blank comes up, and now there is about a 5-second delay as it zeroes out, and now you'll get back to the screen that says the word measure, press measure, and now in 10 minutes this will give you a reading, so we'll wait for 10 minutes. You must wait a minimum of 10 minutes. The numerical number will appear on your screen. The timer can keep clicking and counting, but you must make sure it is greater than 10 minutes. You take the number that is on the screen and record it into your log sheet. You refer to the IFU on what that numerical value means that you read off the fluorometer after 10 minutes.